Let's talk about the three most common injections and the proper way to administer those injections, okay? I'm Erica. I'm the owner of Love Reigns Medical Training Center here in Gainesville, Florida. I'm a registered nurse, and I am an instructor for phlebotomy, medical assistant, CNA prep, and all prep courses, and CPR, first aid, med tech, all the things, okay? So I do have multiple videos out where I do give tips and tricks and things about how to learn certain techniques and just try to educate you guys, especially people that are in school who's trying to learn. So hopefully this video will be useful to you as well. Okay, so first thing first, I want to talk about the three most common injections. Okay, so the first one is this is subcutaneous injection. Okay, this is an insulin needle. If you ever see orange, this tells you that this is an insulin needle. Understand that this is an intradermal needle. Intradermal is what you probably have seen if you've ever seen this. And this is what you've had a PPD done with. PPD, which is a TB test for a job placement. So if you've ever had to, if your job ever required you to get a PPD, that is the injection that you would have used. And that injection, this needle and this needle are technically subcutaneous. They are both the same, but they are used differently, okay? But they are both used differently, okay? But they are both considered subcutaneous because you technically possibly could give a subcutaneous injection with this needle, but most people use the brown top needle for PPDs, okay? That's to check and make sure you are free of tuberculosis is why you would have this done, okay? This is for insulin, okay? And then the third one would be, and this is the actual syringe, and this is the needle, okay? So I'm going to put this together, but this would be your intramuscular injection. IM is how that is usually referred to. It's intramuscular. Okay, so these are the common injections. There's you also may see gluteal injection, understanding that the gluteal injection is also IM, intramuscular into the muscle, but it's going to go into the gluteal muscle, so that'll be like in your butt, in your upper butt part. Right here, okay, that's the gluteal. So a lot of people they sleep on the gluteal injection because the gluteal one is, to me, less painful, but you know, people are scared of getting a shot in their butt, so you never know why they don't want to take it. But so these are the three most common injections. This is the insulin needle, which is subcutaneous, intradermal, and then this is intramuscular. Okay, sub-Q, intradermal, IM, intramuscular. Okay, those are the three injections. When you're doing the sub-Q injection, sub-Q is the layman's term for subcutaneous. So you hear a lot of people in the medical field refer to subcutaneous, meaning in the fat, as sub-Q, SUBQ. That's just a way that we in the medical field refer to that injection. For the most part, you're going to clean that site with alcohol. I want you to understand too that with alcohol, you want to start from the site of insertion, and you're going to go away from it, away out, and never come back. Because what you don't want to do is bring dirty to clean, okay? So once I clean that middle part, I'm going to go away from that site and never come back to that site, okay? And that is, and you want to let that air dry. We don't do this anymore. We're not waving it dry. You're going to let that air dry, okay? Once you do that, for the most part, I just want you to know that you're going to and this little thing here is the bottom. It's just a little thing that comes off, see? So you can, that's just for packaging. But once you pull that off, you'll see you have your plunger here, okay? And then that's the needle. And this doesn't have a safety device on it. So when you're done, you need to put this straight into the Sharps container, okay? So we call it Sharps puncture resistant container. That may be a jug for you at your house. It could be the actual Sharps container. It's still a puncture resistant container, that we want to make sure that when we put this in there that nobody will get stuck, you know, messing around with it, okay? So for the most part, after this is air dried at least 30 seconds, okay? You want to, and I will have, if I was doing this on a, okay, so because I did not have on my gloves before, and some people get confused, so I want you to know that if you were doing this on a patient, you would be doing this with gloves on. If I was doing this at home, I don't need on gloves, okay? But in the medical field, in the medical setting, you should be having gloves. You should have on gloves when you get ready to do the alcohol away from the site and let that air dry. You should already have on gloves, okay? Insulin, whatever the doctor would have said the order, I would have said they gave the orders for 40 units of insulin. You would clean your stopper. For the most part, you would clean your stopper. And you will let that air dry as well. And then we're going to push back. So if I need to pull up 40 units, I'm going to pull back the air for 40 units. And then I'm going to push push that air into here, and I'm going to do it like this. And we would have already verified that this is the right dose, the right amount, the right order, the right everything, right? Now I'm pushing in the air, and then I'm going to pull back to the 40 units, okay? And usually what we'll do is go back a little bit more over the 40 units just to be able to get excess air out, because you don't want to push air into your patient. So I'll probably, for the most part, go a little past the 40. And there's a little extra air in there. And I'm going to push back now. I don't know if you can see that I'm a little below the 40 line. Can you see that dark line right there? That's where I want to be at right there. On that line right above that plunger right there. So I'm going to push that out so I can be right at the 40. And I'll push that up to 40. Because if you give 42, that's a mid-error. So it needs to be 40. If the doctor say give 40 units, we're going to give 40 units, okay? So now I have exactly 40 units, and you can see the 10, 20, 30, 40, that plunger, the top plunger part is on the line. That's the line that you're looking for as far as knowing the exact amount, okay? So now I have my patient here. I'm already ready. I want to pinch the skin, and I'm going to go in on a 45-degree angle. 45-degree angle, kind of like you're going inside of a triangle. See, from the side, and then you're going to push that in, okay? That's going to come straight out and then straight into the sharps, okay? Now, we would make sure, and I wouldn't use alcohol. We used to put alcohol to wipe it off, but alcohol makes you bleed, so you'll use a dry gauze. If need be, you would put a Band-Aid over it, okay? Just so in case they were bleeding, but that would be it. Insulin will be given. You put all your stuff away and document that you gave it and all the things, okay? So that is a subcutaneous insulin injection, okay? Next, I want to show you how to give, and it'll be all the same steps, but for the most part, I want you to know that intradermal is the one I told you for PPD, and this is going to be inserted on a 15-degree angle, which should be really, and the bevel is up. I need to make sure I need to tell you something about the insulin before I move forward with the intradermal. I should have mentioned it earlier about insulin. Insulin is very serious. In a lot of places, insulin is witnessed by 2 nurses before it's administered, because it can kill somebody if you're not accurate when you're getting it. So I need you to understand why you could kill somebody with insulin, and you should be very careful when you're actually verifying the order and pulling the actual vial from the refrigerator, because they have what's called regular insulin and long-acting insulin, okay? Long-acting means it peaks over time, and then there's regular insulin that peaks now. Usually within 30 minutes you're going to get the results of insulin that's regular. The regular insulin will be given to somebody who is running high blood sugars, so we want to get them down quickly, which is why we would give them regular insulin. If you, let's just say the order was to give long-acting insulin, okay, so that could possibly be like Lantus, all right? You would probably be pulling, the order typically might say give 80 units of Lantus. Could be give 100 units of Lantus. I want you to understand that if you pull regular insulin, you got 2 vials. You got a regular and you got a Lantus insulin. You pull regular insulin instead of the Lantus, the long-acting, you could kill somebody, okay? That means if I was to pull 100 units of regular insulin because I wasn't paying attention, because I was moving fast, because you didn't verify everything against your order, you could give somebody who's possibly 100 pounds 100 units of regular insulin, and you would kill them, okay? I need to make sure that when you're doing insulin, because a lot of places don't require 2 nurses to witness it. As a travel nurse, everywhere I went, they required 2 nurses because of how deadly insulin can be if you make a mistake. So I just need you to be very careful when you're pulling insulin. Don't ever go get insulin without double checking the order. And it definitely would not be a bad idea to have somebody still witness it with you, even though it's not a requirement here in Florida. You could still get somebody to look, hey, can you mind checking this to make sure I got the right medicine, because you do not want to take that risk, okay? I'm just saying. So that's my spill on insulin. Just be very careful. That's with any med, but I just want you to be aware that insulin, 2 different insulins, you could kill somebody if you pull the wrong one, okay? That's it. So let's do it. Intradermal. Bevel up. You always want to make sure that the bevel is up, okay? So you got to look for the opening. The bevel up, it means that the opening is facing up. It's probably hard to see here. But with the intradermal injection, pretty much PPD, right? Or they also use these type of needles for allergy testing. But for the most part, we use it mostly for, and just so you know, typically it would be 0.01. And this syringe comes in 0.1, 0.2. That's how it's increments, okay? Incremented. So this would be 0.1. For PPD, it's always 0.1. That's the standard for the most part that you would be pulling to give the patient, okay? Now you're going to make sure that your bevel's up and the angle is a 15 degrees. So it's pretty much flush. People think they got to put the whole thing in there. You don't need to put the whole needle in there. You literally only need the opening of the bevel under the skin in there, okay? You're going to push in that 0.1 and that should give you a beautiful bubble. Okay, that should give you that bubble that if you've ever seen a PPD, and that's called a wheal. That bubble is called a wheal, WHEAL. That is what we're going to monitor for 72 hours to see if you are positive or negative for tuberculosis. They want to know, have you had any exposure to TB, and that's what we're checking for, okay? Once you're done with that, that will be discarded. This does not have an activation device on it either. It needs to go straight into the sharps container, okay? That makes sense? We will clean. So that site this person will be coming back within 72 hours, so we can look. What should happen is that bubble, the wheal, should dissipate back into the tissues without any issues. On occasion, somebody might have a reaction, meaning some swellings or redness, some bumps, whatever could pop up. Then this person maybe have had a reaction to the antigen, and they're going to need to have a chest X-ray, and they're going to need a chest X-ray going forward completely every time they ever need a PPD. So you don't really want to be positive. You don't really want a reaction from it, okay? So that's the intradermal. The last one I want to do really quick, because I'm trying to wrap this up, is I'm going to have all my gloves. I'm going to check my order. I'm going to do all the stuff. Y'all understand that these would have been 3 different patients, so we would have washed our hands, guys, our stuff, all the things. I'm just kind of showing you each injection with the same gloves on, but you would not be using the same gloves. I hope we're clear on that, okay? This is an IM injection. This is a 90-degree angle. We would have cleaned that site the same way. Okay, and I just want you to know that I will clean from the insertion site away from the site. Let it air dry. We're not waving it dry. Let it air dry. And then this is what's called a needle activation device. This is so basically we'll pull that off. And this is a big needle, y'all, 21. But we wouldn't be probably using a 21, okay? Probably more like a 25, okay? But this little piece here is what's going to lock the needle once you're done, okay? So once you're done, you're going to push that up and that'll lock the needle so you don't have an accidental needle stick, okay? That's the biggest number of injuries in the healthcare is accidental needle sticks. So we got to make sure we're always careful with that, okay? You should never be taking this in a room with a patient to give an injection if it doesn't have an activation device. The insulin and the other ones are, they sometimes don't have, but these should always have an activation device. All of them should if you can, okay? But now I want you to know that we're going to go on a 90-degree angle that's ready to go. I would have already asked if they have allergies. I would have asked them where they prefer to have it at, all the things, okay? But for the most part, we're going straight in like a dart. You don't need to go slow and till you feel every tissue, okay? Literally 90-degree angle like a dart. And then we're going to push that medicine in, okay? Now, what I want you to know, too, is that people do this sometimes and it's going to cause a problem. People want to do this. You see how my finger's on the plunger? They want to do this. And what's going to happen is they're going to push this into, this medicine's going to get shot. So, again, you never want to start your injection off with this like this. You need to do it like a dart. Straight in, then plunge. Don't forget, because you're going to accidentally shoot that medicine out, and some of those meds that we've drawn up could be thousands of dollars of medication. So they probably going to do a whole incident report and write you up if you make that mistake because of the cost of that medicine. So I'm just saying be very careful that you don't put your finger on the plunger. You want to put your finger here and then push that medication in and come straight out. And then we want to massage that in. Some of that medicine's a little thick and it can cause a knot under the skin. So kind of rub it in a little bit. Like when we got the COVID shots, we had all those knots on our arm. This will be pretty much right here in the deltoid. This is the deltoid muscle. Now this can go intramuscular, be in the gluteal, like I told you earlier, the arm, okay? So in the thigh, you can put it in the thigh. So those are all intramuscular injections, okay? I hope that helps you. I'm going to give you a quick review of what injections are, especially for anybody who's going to school to become a medical assistant. This would be something you'll be doing in your role as an MA. MA is a pretty important job, a pretty exciting job. So, yeah. Anyway, that's all. If you have any questions, listen below. I'll talk to you later.